Hello everyone, myself Anusha Anand, working as a tutor in M College of Nursing. In this video, we will talk about side effects of chemotherapy. Chemotherapy in the body. Effects of chemotherapy on our body. Chemotherapy can interfere with the body's ability to produce healthy blood platelets, red blood cells and white blood cells. Low blood cells, low blood counts can lead to a variety of serious side effects. How chemotherapy causes side effects on our body. Cancer cells divide more quickly than healthy cells, and chemotherapy drugs effectively target those cells. Unfortunately, fast-growing cells that are healthy can be damaged too. There are many different chemotherapy drugs with the potential for many different side effects. These effects vary from person to person and from treatment to treatment. Chemotherapy can cause unpleasant side effects, although many can be treated or prevented, and most will pass once treatment stops. Following are the side effects. Let's see one by one. First, infection and a weakened immune system. Cancer and the treatment can weaken the immune system because chemotherapy kills healthy immune cells. It can make a person more vulnerable to infection, and because the immune system is weakened, any infection may last longer than usual. Eating plenty of fresh fruits and vegetables, frequently washing the hands, avoiding anyone with an infectious illness, and seeking prompt medical care for signs of an infection can reduce the risk of a serious illness. Second, bruising and bleeding. Chemotherapy can cause a person to bruise or bleed more easily. Many people having chemotherapy experience this side effect. Bleeding more heavily than usual can be dangerous. It is a good idea to take precautions such as wearing gloves when gardening or cutting food. Also, take extra steps to prevent injuries such as hair loss. Chemotherapy can damage hair follicles, causing the hair to weaken, become brittle, and fall out. Any hair that regrows may be of different texture or color. This usually continues until the treatment ends, after which hair almost always regrows. Although hair loss is temporary, alopecia may adversely affect self-image. Hair loss may be thinning, partial or complete, and may involve the scalp, eyebrows and eyelashes. Hair loss may begin in 7 to 10 days after treatment, but sometimes begins even before treatment is completed. Regrowth usually occurs 3 to 6 months after the last treatment. Care of the scalp should be the same as that for any area of exposed scalp. Fourth, nausea and vomiting. Nausea and vomiting are two of the most common side effects of chemotherapy. Vomiting is a reflex controlled in the emetic center of the brain stem. Uncontrolled nausea and vomiting can lead to fluid and electrolyte imbalance, impaired nutrition, non-adherence to treatment, and a reduced quality of life. Dietary changes such as eating smaller meals or avoiding certain foods, can help. Anti-nausea medication can also help, especially if a person experiences the side effects at predictable intervals, such as immediately after chemotherapy. Neuropathy. Neuropathy is nerve pain caused by damaged nerves. It often affects the hands and feet, causing tingling, numbness, and unusual burning sensations. Some people also experience weakness and sixth, constipation and diarrhea. Chemotherapy may trigger digestion problems because it can damage cells that help digestion. Other side effects of chemotherapy, such as nausea, can force people to change their diets, but these changes may also cause or worsen constipation or diarrhea if they are sudden. Avoiding foods that irritate the stomach may help, and over-the-counter remedies for constipation, such as a stool softener or fiber supplement, can make bowel movement less painful. In addition, being well hydrated can reduce the severity of constipation and also prevent dehydration caused by diarrhea. 7. Rash. Chemotherapy can alter the immune system in ways that causes rashes and other skin changes. The drugs can also trigger skin changes directly. Severe rashes can cause painful, intense itching. If a person scratches until the skin bleeds, there is a risk of infection. Moisturizing lotions and over-the-counter anti-itch creams may help. 8. Mouth sores. The mucous membrane of the GI tract, especially those of the mouth, can become red, irritated, and inflamed. Stomatitis can range from a mild irritation to full-blown sores with difficulty swallowing. Chemo-related stomatitis usually begins 5 to 7 days after treatment and lasts about 10 days. The soreness can vary in severity and the sores may bleed or become infected. A person can try using a non-abrasive toothpaste or a numbing gel. Some people also find relief from rinsing their mouth with warm salt water. 9th, breathing problem. Sometimes chemotherapy can damage the lungs and make it harder to take in enough oxygen. Breathing issues can also result from some type of cancer. Staying calm, sitting, and propping up the upper body with pillows and practicing pursed lip breathing may help. 10. Pain. Some side effects of chemotherapy can cause pain. For example, there may be pain in the mouth and throat, possibly due to oral sores, nerve pain, pain at the injection site, headaches. Pain can also occur as cancer progresses. 11th, anemia. Chemotherapy lowers the red blood cell count. Organs and tissues inside the body get the required oxygen from red blood cells. If the count of red blood cells goes down extremely, the body will not get adequate oxygen and anemia is the consequence. Anemic patients feel tired and that may have other symptoms like palpitations or irregular heartbeat. 12th, experiencing fatigue. Fatigue is not one such symptom that you would recognize unless it is too overpowering. In case of patients undergoing chemotherapy, fatigue is not just a general feeling. As a patient, one might experience severe tiredness in doing some of the routine tasks. Previous slides we have seen some of the common side effects. Now here we will see rare side effects. Some people experience rare side effects of chemotherapy. Hypersensitivity. This involves the immune system reacting to the chemotherapy drug. Extravasation. This is when fluid leaks from a blood vessel into surrounding tissues. Neutropenic typhlitis. This is inflammation of the gut that can affect people with a weakened immune system. Pancreatitis. This is inflammation of the pancreas. Acute hemolysis. This involves the destruction of red blood cells. By this, we will conclude this topic. See you soon with more new topics. Till then, bye.